Welcome to the GRC Summit Leadership Series. My name is Phillip Beniac and I'm the Regional Director here in Asia Pacific. Today's topic is about bringing ethics and integrity to the forefront from a healthcare perspective. In healthcare, the focus has always been on ethics and integrity for patient care. Healthcare covers a spectrum of ethical challenges, from clinical trials, human rights violations, to maintaining ethics in pharmaceutical sales and marketing. There are many areas that need attention, specifically around compliance. Today, let's learn from a professional who knows firsthand how to define the balance between high-performance culture and ethics, facilitate change in support functions, including compliance, becoming enablers to support long-term revenue while enhancing reputation. Seeing healthcare pharmaceutical organisation being the trailblazers in ethics and compliance, and strengthening and fostering a culture of integrity throughout the organisation by communities by embedding reputation excellence within the corporate governance framework. I welcome Nitin Chhatwani, Chief Compliance Officer for Asia Pacific for GE Healthcare. Good evening, Nitin. Thank you for giving us your time this evening. Could you just share, before I ask some questions, could you just share a little bit of background about your journey through the compliance world? Nitin.
Good evening, Philip. Thank you so much for that introduction. And no, I think it has been, as you mentioned, I think it has been a very interesting journey. I have spent last few years, I would say about 3+ years in core compliance related activities, but I have been very closely associated with compliance throughout my career. So when I was part of the finance and controllership function, I was doing a lot of different audits. I was fortunate enough to get opportunities across the globe. So I moved around from, I started my journey in GE and closely related to compliance, like I was mentioning. When I was in the UK, I moved to the US. I was on assignments where I was literally living out of a suitcase for 2.5 to 3 years, 99% of the time traveling in different countries across the world in a situation, in a land where language probably is a challenge, is something new. Culture, was very new. And I think that was the whole idea of the program, is to really be able to focus on the business processes and risk and find a way to make sure that people understand the importance of compliance and integrity. And at the same time, I think it was a learning exercise. I went through this executive learning development program. So here I am. I think I've been in Singapore for almost 10 years now. And it has been very interesting. So I've been part of GE Healthcare, been part of the healthcare industry for, I would say, for most part in my work experience.
Yeah, so it's just fascinating. Obviously, been in several positions within the GE company. I mean, obviously, with GE being such a trailblazer in many ways and in many facets, it's obviously you bring great experience into this realm. So, how do you define a culture of compliance and integrity when you look at some of the initiatives that you have been adopting and driving within GE Healthcare today?
Yes, and Philip, I think it is a challenge. At the same time, I think there are a lot of learning opportunities as well. We keep adjusting, we keep learning, along the way as we kind of come across new developments. As you mentioned, I think healthcare is one of the most regulated industries across multiple industries for the pure reason that healthcare should be for improving people's lives. Healthcare should be to treat patients better. Healthcare should be to be able to diagnose problems or diseases so that timely treatment and timely care is provided to people across, which means healthcare, all decisions or all transactions which the companies, the hospitals, the ministries of health, the departments of health are making should be free from any bias. And that is why the added responsibility, added pressure on companies to make sure that they have a solid infrastructure, that they have a very good infrastructure to be able to manage those risks, mitigate those risks. So it has been a very interesting journey. I think you cannot learn more, or you cannot kind of adapt to a better environment or a platform than healthcare and some of the other, of course, industry, like, for example, financial services is another highly regulated industry. So I'm fortunate, to be part of this. What I have, seen, of course, given, the requirements and given the regulatory requirements as well, we have invested, and I have been with companies and I've made sure that we are investing in that infrastructure, having the right compliance program, having different teams looking at different areas, having solid processes and policies in place to make sure that people are able to follow, they understand, having a good training program. So I think that goes without saying. But at the same time, one of the most important things I always try to kind of work with our management teams is how do we build and develop a culture of compliance and integrity, which means how do people feel that compliance is part of their day-to-day job, their day-to-day task. Integrity is something which cannot be taught. I think integrity and values and ethics is something which you're born with, right? So how do you kind of take it to the next level? How do you make those decisions? In healthcare, for example, we make decisions, for example, purchasing decisions, or making a payment towards services, or making a payment towards research activities to develop a product for advancement of medical technology. Those decisions you have policies in place. It's mentioned black and white, in the policy. What are do's and don'ts? You have guidelines, you have procedures in place. But what the policy doesn't address, and policies are written based on the regulatory environment and from the experience, what policy doesn't explain is what can happen in future. What are some of the new developing business models? Which means we are making decisions, or the teams which are working with customers and the ministries of health and different departments, they are making decisions which could be potentially in the gray, if I can put it that way. And so what I really try to instill is having that culture of integrity. If you're able to make those decisions and you're able to back up those decisions, which means you're making risky decisions, but you can back it up, you're willing to be held accountable if anybody questions that, why did you make a decision towards this? And if you're willing to be held accountable, you can explain, go ahead and make that decision. If in doubt, we are, of course, we have compliance, we have legal teams, we have finance controllership teams. So please do reach out. So I think that's number one. Second, within the organization, it is very important that people feel part of an open culture. They should feel that all your employees should be able to feel that there is no fear of retaliation if they voice their concern or if they identify an issue. And it's a big learning for us as well. Right? So I think for us as leadership, for us as compliance professionals, we should be able to go back and report back the numbers to the teams, having a metrics in place that say, because of voicing the concerns, because of people came and spoke to us, this is what we learned, this is what we identified. It may not mean always that there is a disciplinary action, but it may also mean for the business, it's a process change or it's a learning. So I think having an open culture, making sure that there is no fear of retaliation when people should be comfortable to kind of talk about whatever they're seeing. It doesn't only help us, it helps their teams, it helps the company at large. Is very
And I think that's right, because what you're saying is obviously top-down leadership is important, but really it's actually bringing responsibility to the mainstream of the business to understand that in-stream decision-making in context of the environment they're in, with the ethics and the openness and the transparency that follows with that is the most important function there. So yes, I absolutely, we see that through many organizations as well. There couldn't be a question without talking about the pandemic, because otherwise it wouldn't be possible. But from your perspective, what are the challenges that you face, and how you're tailoring your compliance and ethics programs around this new phenomena, this new normal? It'd be interesting for you to sort of share some insight into that.
Yeah, and I think Phillip, you touch on a very prevalent topic, and I think it's on our minds. We'll be lying that we're not facing the challenges ourselves. Making sure that we keep the same standards up or even higher standards. In times like this, all of us, I think it's learning and it's change for everybody. Learning and adapting, I think, is the key. Same thing applies for people like us and programs like ours, compliance programs. One of the biggest things I think which which the first thing I think which came to our minds and we started really working on was now given these changes. So even before that, sorry, I would say is employee health and safety is number one concern, right? Which is for any management, making sure, because if people are working in an organization, they're associated with a company, for example, GE and other big companies as well, it's a given that they will be secured, safe, and they will have a longer, future and association with the company. So it is our responsibility to make sure that the employees are safe. I think that's number one. The second thing is, I think with these changes, people are working from home. But most of us have been working from home since last 3 months or so, or in some countries probably longer than that. Privacy is a concern, right? There is a lot of sensitive information, company-related information, business intelligence-related information, which is on people's devices or while they're on meetings and having discussions and sharing that information. How do we make sure that that information is safe and secure? So privacy, we had to activate privacy policies. We had to go back and check with our privacy councils and kind of work through this and communicate with our employees. Some of the other things, I think, taking a step back and looking at this whole situation, if a company has already invested in a strong program like crisis and security management, regulatory teams, because to be able to monitor all the regulatory changes, quality of our products and services, at the same time, health and safety standards in the company. So I think as a compliance professional, the responsibility is to make sure that how do we kind of bring this all together and how does all these functions kind of come together and work. And I think that is the most important thing. Some of the other things I think which we as compliance, we have, we have to monitor more because times like this, you have to make sure, because the government is making a lot of changes. There are new announcements. There are relief measures as well, which means the risk of fraud goes up. So how do you kind of keep a tab on some of those measures? A risk mapping is important because during this time, during a pandemic situation, there is politics, I think, in some countries, which also starts impacting decision making. So I think that risk mapping is very important, making sure keeping abreast of all the changes in different countries, in different environment, and how do you kind of map it to the risk which we are already aware of, and how do we make sure that we keep our employees, our channel partners, our customers abreast and aware of all those changes and be able to kind of put those programs. And of course, we're getting a lot of exception requests as well. And, we have a corporate social responsibility towards donations and having, all of it working.
Yeah. So what you're saying, it all goes back to the organizational beliefs, code of conduct, and really investing in a strong, what I would say, infrastructure compliance capability is fundamentally important. Whether it's in a COVID situation or not, it's obviously more extreme today with levels of uncertainty. But then, with proper investment, you have the ability to ride through that, even in situations where you are challenged.
Yeah, absolutely. The whole machinery has to come together and work.
Yeah. During this time, all organisations are focused, and you touched on it, health and safety of employees, which is very, very important. And I think that with the healthcare industry in general, and we can say this across all industries, but just the healthcare is very much a pronounced community of customers, suppliers, and dealer dependencies. How do you ensure that continuous delivery of service and capability through your partner ecosystem in terms of compliance and testings and capabilities around that? If you give us some insight into that would be good.
Yes, and again, another interesting topic, and which keeps us always on our toes and keeps us very busy. Whether in times of pandemic or during normal course as well. We have to, and again, that depends on where your kind of, where your footprint is, company's footprint is. Emerging markets, I think when it comes to relying on third parties and suppliers, emerging markets, I think, is more compared to some of the developed markets, as well as we see different business models. And I'm sure different companies kind of adopt different ways they have a different mix of direct versus indirect model. In emerging markets, it's more because there are a lot of remote locations and there is heavy reliance on dealers and suppliers and working with some of the other companies, which means the risk, of course, heightens when it comes to engaging these third parties and dealers or channel partners or indirect channel as you may put it. So again, having a tailored program, like I was explaining, whether it's emerging markets or some of the remote locations, or sometimes you call it orphan sites, which are really far away. There are very few hospitals, and they need that care, they need that equipment, and you cannot enter into that territory without getting help from some of the local companies, which are much smaller. So how do we make sure on companies like this, there is a program which really works? I mean, you cannot apply one size fits all, to different. So having a strong due diligence program, having a robust due diligence program, keeping that contact with some of the third parties, having a very strong program to make sure that we know who these companies are, we understand the background of these companies, what is the shareholding structure of these companies, who's actually running these organizations, third parties which we are going to engage. And while, once all of that is complete, having a strong watertight contract management, making sure that, we have a strong procedure in place, clear terms and conditions on how we kind of work, which of course has to be agreed upon. And I think one of the things what we have learned over the years and tried to focus more on compliance and some of the support functions or enabling functions, I think usually get involved at the time of, onboarding and then offboarding the third parties or suppliers. But what is important is you have to keep contact during the course, during the life cycle of, engagement or the business, we're conducting. Whether it is, visiting their sites, visiting their warehouses, doing face-to-face trainings, which is important as well. Looking at transactions and going and having discussions on what challenges are they facing when they're working, with the customers, when they're representing companies like ours. So I think it's very important to keep that going. And the closer you are, the more comfortable you will be. And of course, you do have nowadays. Of course, there are very strong processes and strong due diligence programs in place.
So essentially, what it is not all third parties are equal. And not all markets are the same, but actually having that life cycle, a capability of not just onboarding and offboarding, but that process in and around actually building that relationship and ensuring that you're very close to the third parties is essential for the business and continuity of the business. So that's good. Well, we live in all a digital environment. We're all sort of surrounded by technologies, whether it be artificial intelligence, robotic process automation, machine learning, conversational chatbots. In fact, I was just online talking to one of my banks, and I was talking to a chatbot, trying to make some sense out of it, but it was also interesting. But in terms of compliance, how do you see this technology really help support the balance around the integrity of compliance, but also relating to the performance of the organization? Do you have any sort of insights on how you can leverage this technology and capability within your organizations?
Yeah, again, another great and very relevant point I think you mentioned, Philip. And this is something we've been working on, and not just we as a company, where you have to kind of adopt or implement technology, the examples which you gave, but I think that's the need of the hour as well. Which means the companies or group companies, hospitals, which predominantly I think are customers as well, they are also looking to collaborate with technologies like this. It doesn't mean that, of course, internally you may have as strong as an infrastructure as you can with privacy concerns, because that's, I think, number one. You have to make sure that there is, these technology are safe, secure, which means the vendors, and sometimes you can't do it just by yourself. You need to kind of engage some of the service suppliers and vendors, the systems, equipment, and technology which they are using. How do we make sure that they are fully encrypted as well? The information, before even we put certain programs in place, or before we digitize or implement these technologies, how do we make sure that the information is channeled to the right teams? So information which is needed for assessment goes to the team which assesses. Information which is needed for management goes to the management, and information which needs to be reviewed, to be able to mitigate the risk goes to the right, parties as well. So that, and I think on top of it, we also have to comply with the regulatory requirements. GDPR is one example in Europe, which is very strong and there are regular reporting requirements as well. There are some regulatory authorities in certain countries which have a very prescriptive program on information security, on technology, on data privacy. So it is cumbersome, but it definitely helps us to be ahead of the curve. And applying those learnings to some of the other jurisdictions or other markets, I think is another area which we learn. Sometimes I think we use this technology, artificial intelligence, for our internal use as well. Which helps us in analytics, performing analytics, doing more predictive analytics to be able to assess the risk and mitigate the risk. I mean, as part of risk management, it's not just identification of risk, but how do you measure that risk? How much information you had before even that came up. Once the risk is measured, it becomes a lot easier for people like us to be able to discuss with management and assign ownership of that risk. Once you assign that ownership, then I think it's just about monitoring and making sure that you're making the right decision. So technology is an enabler as well, helps us a lot.
Have you looked at it from the area, like, for example, the ethical AI? Using AI in an ethical manner within the organization is to obviously business performance is very, very high and it needs to be done, but it's also the element around, is this right? Is this what we need to be doing in the market? Is there any sort of insight into that?
Yes, and again, Philip, that is something, from a healthcare perspective as well, I would say we were, healthcare companies are ahead, of the curve in that, because it's not only, from an AI perspective, but patient data, patient records have to be very carefully managed. To be able, for healthcare companies to be able to sell better or have that performance, as you were saying, it is very important that some of that information gets connected. Right, your one patient, for example, may go to multiple doctors and multiple hospitals, and not necessarily that data flows easily from one place to another. How do we make sure that that is, you have all the relevant information, you have all the right information to be able to make that decision without sharing any information regarding patients to this? So I think this was one of the examples as well. But those principles I think apply in the AI and cybersecurity space also. So once you engage some of the technology or service providers for this, I think you look at platforms which are fully encrypted and make sure that we don't kind of take it to another level where there is leakage, for example, of data.
Yes. Obviously, many years in compliance. Any closing comments that you have in and around advice to other compliance officers today that will be listening into this this event into the future? Any advice? Any steps that you can continue to strengthen the culture of integrity, awareness, in managing business performance, etc.? Any advice would be great.
Yeah, no, thanks, Philip. And probably, I think I'm probably, repeating myself as well, but it's important that, we create a culture, we instill compliance, I guess, in the leadership, the middle management, and also employees at large. And I think it is very, very important that it's not just the tone from the top, that leadership gives that message, but it's the managers, people managers also understand. For employees, I think it is very important that there is a culture of constructive conflict, that they are free to come and talk to their managers. And I think usually managers probably are the first sounding boards for their staff and for the employees. So it is important for managers to be able to assess, to invest time and invest resources to be able to assess, this culture where there is, open dialogue, there are open discussions, and making sure that people are feeling comfortable without any fear of retaliation. Now, retaliation can be in many different forms. Sometimes it's not as clear, sometimes it's more subdued. It's only the person who feels it can probably, express it, which is very important that people should come and talk. So I would say creating an open culture, taking ownership of compliance in everything you do, whether you're working with customers, working with external parties, and most importantly, making sure that employees are the ones who are expressing it. Because we can put whatever systems, whatever processes, whatever policies in place, but it's the people on the ground who are the best judge of what is happening around them. So if we don't hear from them, I think the program will always fall behind, and you're always playing a catch-up game.
Yeah, yeah. So really, it's bringing that community together, whether it be the dealers or third parties, and obviously the patients in the end, which are the most important. And really, an organisation like GE Healthcare, phenomenal reputation in the market, specifically in areas, emerging markets, which is fundamentally important. Even as of today, I really thank you, Nitin, for the opportunity of spending the time with you this evening, and yeah, appreciate it. Thank you.
Thank you, Philip. Thank you for that. Great speaking with you.
Thank you.